So I would say the number one misconception is people come into my office with these cosmetic spider and reticular veins, and they think it's the cause of their leg symptoms. So I wanted to make something very clear right now. Spider veins do not cause symptoms at all. They're usually associated with the problem that's underneath their spider veins. 90% of leg pain that people come in who don't have a varicose vein, they don't have a venous origin source of their pain, is musculoskeletal. I cannot tell you how many patients I see with sciatica, hamstring injuries in my office on a daily basis. I probably see 5 to 6 patients a day who have a musculoskeletal disorder that was never diagnosed properly, and they were never told what to do. So, as a leg pain doctor, I spend a lot of time educating patients on what they actually have and then telling them what they need to do to fix it. And the astonishment on their faces is priceless. First of all, they're extraordinarily happy that somebody diagnosed them. They're extraordinarily happy that somebody told them that what they can do for it. And when they come back and follow visits, they're extraordinarily happy because their pain's gone and they feel better. But 90% of what they have is musculoskeletal. I'll give you another example. I have many, many elderly patients who come into my office with leg swelling, and all of them have arthritis, and not one of them has been told that they have arthritis. I literally pull up my pant leg and show them my joints, and I said, look at my leg compared to your leg. And their knees are like twice the size of mine, and they're shocked to find out that they have arthritis. And then when they finally get to see an orthopedic surgeon, they're like, nobody ever told me. And I said, nowadays, just like in venous disease, there's minimally invasive options. It's not just a steroid injection anymore. They can get gel injections, they can get braces, they can get a ton of other things done for them. And then finally, the other thing is, most people don't understand the correlation between their weight and their leg symptoms. They know they're heavy. They've been told that they're overweight, but they don't realize that that's causing their pain. And so I end up having very long discussions with people regarding ways to achieve weight loss that don't necessarily involve bariatric surgery, because most patients don't want surgery. So I give them very simple ways and things that they can do, because once they lose that first 5 to 10 pounds, that's it, they're hooked. And they're going to move on, and they're going to lose it. And the patients who have lost a significant amount of weight after talking to me, it's probably about 10 to 15% who actually do it. But that's 10 to 15% that wouldn't have done it had we not had the conversation. And it's life-altering conversations. Their pain's gone, they get rid of their weight, they start managing their health better. So you think, well, why is a vein doctor telling people about general overall health issues? Because they're coming with leg pain and they don't know what the cause is. So going back to my initial comment, we take a holistic approach to the patient. And my big selling point to my patients is, you're not going to leave my office without an answer. 99% of the time I know what it is. 1% of the time I look at them and say, I have absolutely no idea, but I know somebody who can figure it out.